I'm Dr. Sri. I'm a board-certified family medicine and sports medicine doctor. In this video, I'm going to show you 4 exercises to do when your knee is acutely swollen and painful due to arthritis. So I see a lot of patients with arthritis, and sometimes they come with an arthritis flare-up. So basically what that means is that their knee is really painful. They're not even able to bend their knees. They're not able to straighten the knees all the way. And sometimes the knee is also swollen too. So during this time, what happens is that the pain also causes the muscles to shut down. So when you have shutting down of the muscles can become weaker, and then the threshold for arthritis flare-up becomes lower. So this becomes a vicious cycle. So that's why even though your knee is swollen and painful, it's important to make sure that we keep the muscles active so that we can get back to activity sooner, okay? So the 4 exercises that I'm going to show you are going to be done without bending your knees, which means that you don't have to worry about pain, and we're just going to focus on isometric contraction of some of these muscles, the supporting muscles, and thereby, when the acute inflammation settles down, then you can get back to a little bit more challenging exercises, thereby going to a little bit of weight-bearing exercises and so forth, okay? I've created a separate video on how I treat knee arthritis patients with acute inflammation. So you can actually watch the video after the end of this video so that you know how to get that acute inflammation better, okay? So without further ado, let's get started with the exercises. So the first exercise is called as the supine ankle pump. I feel like this is a good warm-up exercise for your quad muscle, for your calf muscle. So the way we're going to do this exercise is that you're going to lay down, okay? And then I want you to keep all the muscles relaxed. And then all you're going to do is that you're going to bring your ankle all the way towards you and then away from you. So almost like, gas pedal, you're pressing the gas pedal and then you're releasing the gas pedal. So, and I want you to make sure that you kind of go through the full range of motion on your ankle and then come back all the way back. So we're going to do this movement for 1 minute straight when we do the 10-minute exercise routine, okay? So the next exercise is called as the supine knee flexion. So for this exercise, I would recommend you to wear some sort of a sock or maybe have a towel so that we can slide our legs easily, okay? So we're going to lie down. And again, when I see patients with knee osteoarthritis, some people will have severe pain when they're trying to extend the knee, or some people will have pain when they're trying to bring back the knee. So all I'm trying to do here is I'm trying to make sure that we stretch the joint capsule, we stretch the muscles around, and thereby to help improve the range of motion. So let us say we're going to start here, okay? So the person is like, they're comfortable at this position here. So all you're trying to do is that you're trying to bring your ankle all the way towards your buttock, okay? So make sure you're not drifting this way. So if you're drifting that way, then you're going to put a lot of stress on the inside of the knee and thereby causing, let's say you have pain on the inside of the knee, then can cause worsening of the pain. So you make sure that you kind of like come in a straight line, okay? All the way straight line. And let's say you're able to only come up to here, then that's your tolerable range of motion right now, and then you go all the way back. But your goal is that as you continue to work towards the exercise, you want to slowly improve your range of motion. So for example, like, my full range of motion is going to be all the way here. Whereas for some people, let's say someone has got bone-on-bone knee osteoarthritis, they might be able to come only up to here, and that's okay. Again, do it whatever your tolerance is. So again, you're going to go up straight, and then you're going to come back all the way. And we're going to do this knee flexion slide for 1 minute straight while we do the 10-minute exercise routine. So the next exercise is called as the supine knee extension stretch. So here you need a towel roll, okay? And I'm going to, so basically roll the towel, okay? And I'm going to put it here. And so you're going to lie down, okay? And then you're going to put your your foot on the towel roll. So when people have pain, they don't like to extend all the way, which is basically kind of straighten the knee all the way like this. So the goal of this exercise is to slowly relax the tightened muscles. Sometimes because of the pain, you're guarding your muscle. So because of the muscle guarding, you don't want to straighten all the way. So the goal is to help you relax, okay? And then slowly let the quad muscle relax, let your hamstring relax, and then slowly get your knees straight all the way. So we're going to spend 30 seconds on one leg, and then we'll be doing alternate on the other leg. Okay, so basically we'll be trying to straighten the knee all the way down like that. Okay, again, as I said, sometimes if you have a lot of guarding, that's okay. Just make sure that you relax and slowly relax, and then get the knee straight all the way. Okay. So the next exercise is called as the supine quad set. Again, for this exercise, we also need a towel roll. So I'm going to roll the towel, okay? And now this time, I'm going to put the towel just behind my my knee, okay? So just like that, okay? So with one leg bent, the other leg straight. So now, let us say if you have a lot of pain when you try to strengthen all the way, then just make sure that you roll the towel a little bit more thicker like this, okay? And then, so I'm going to keep my leg, I'm going to keep the towel just behind the knee. And then the goal of this exercise is to make sure that you press the knee all the way on the towel as you squeeze the muscle. And I'm going to hold the squeeze for 3 seconds, and then I'm going to relax. Again, push the towel, hold the squeeze, and then for 3 seconds, and then relax. So we're going to do 30 seconds on one leg, then we're going to do 30 seconds on the other leg. Again 30 seconds, and we're going to do 3 sets total for each leg, okay? Same concept here, right? So push the knee down towards the towel as you squeeze the muscle, and hold the squeeze for 3 seconds. So the other tip would be as you squeeze, just make sure that you bring your ankle towards you as you keep the squeeze, and then relax. Again, up, push it down, push the squeeze down on the towel, bring your ankle up, and then hold the squeeze, and then relax. Okay? So the next exercise is called as the prone glute set. But once you start to get better, I would probably switch to what I call as an hook-lying gluteal set. So the first exercise, the prone glute set, is probably better for people who still have a lot of pain and they're trying to bend their knee all the way. So you're going to lay on a prone position. So basically your stomach is going to face the floor. And then all I'm going to do is that I'm going to just squeeze my glute. So I'm squeezing my glute muscle, my buttock muscle here. I'm going to hold the squeeze for 3 to 5 seconds, and then relax. 3 to 5 seconds and relax. As you can see, as I squeeze the glute, I'm also tensing my quad muscle too. And you will feel your pelvic floor muscles are also kind of squeezing too. And that's all you want to do. You want to squeeze as hard as possible, squeeze the buttock muscle for 3 to 5 seconds straight, and then relax. Squeeze it for 3 to 5 seconds and then relax. 3 to 5 seconds and then relax. So once this gets easier, then you will go on to the supine hook-lying gluteal set. So for this exercise, you're going to lay on your back, and then, so let us say you're able to bend your knee up to here, which I would say that this might be the prerequisite for the supine hook-lying gluteal set. So bring your ankle up, and now what you're trying to do is that you're trying to drive the heel on the floor as you squeeze the buttock muscle. So you'll feel you'll feel like my buttock is slightly lifted up as I squeeze, and then relax. Up and then relax. So again, drive the heel on the floor as you squeeze the buttock muscle. You're squeezing the hamstring muscle, and then relax. Again, squeeze the hamstring, squeeze the buttock, and then relax. Squeeze, hamstring, buttock, and then relax. Awesome. So usually I tell my patients to do these exercises every day, okay? Even up to 2 times a day, because these are all very low intensity, or they're not causing a lot of muscle damage or so. It's basically more activating these muscles, and it'll be better to do it more frequently rather than just to do 3 to 4 times a week, okay? So every day, even up to 2 times a day. So once your knee is starting to feel better, you're able to weight bear without much pain, your swelling has improved, that is a cue to start building real strength. So I've created a step-by-step 3-phase rehabilitation plan for knee osteoarthritis that'll take you from phase 1 all the way up to phase 3, add challenging exercises to build strength and stability that you would need for the long-term treatment of knee osteoarthritis, and you'll find this video here. If you found this video helpful, please make sure that like button so this video can reach more people. If you want me to do a small favor, please put some appreciative comments in the comment box below. That will really help out this channel as well. If you want to know how I treat knee osteoarthritis without surgery in my clinical practice, then check out this video here, and I'll see you in the next video. Until then, goodbye.